Good afternoon, folks. This afternoon's topic C is why are elderly vulnerable to C. diff? Okay, we're going to discuss that for C this afternoon. So please join me for today's discussion C. Here we go. Here's a clear, grounded explanation of the text based entirely on the page you're viewing. The article explains what C. diff is, why older adults are especially vulnerable, how to recognize symptoms, and what treatment and prevention looks like, with an emphasis on the unique risks for seniors. Okay, so here we go. What C. diff is and why it becomes dangerous. C. diff is a bacterium that causes severe diarrhea and inflammation of the colon. It usually appears after antibiotics disrupt the gut's normal bacteria, allowing C. diff to overgrow and release toxins that damage the intestinal lining. Why older adults are at higher risk. The page highlights several overlapping reasons. Recent antibiotic use wipes out protective gut bacteria. Healthcare settings. Hospitals, nursing homes have high levels of C. diff spores. Aging immune systems are less able to fight infection. Chronic illnesses, IBD, kidney disease, cancer weaken defenses. History of C. diff increases the chance of reoccurrence. Together, these factors make C. diff disproportionately dangerous for seniors. Symptoms to watch for in older adults. The article stresses that early recognition is critical. The key symptoms include watery, foul-smelling diarrhea, often 10 to 15 times per day, abdominal pain or cramping, fever, nausea, loss of appetite. For older adults, the page notes several red flags that require urgent attention. Diarrhea signs, dehydration signs, dizziness, low urine output, swollen abdomen, confusion, which may appear before digestive symptoms in seniors. This aligns with what you often emphasize in your work: confusion as an early infection signal in elders. 4. How C. diff is diagnosed and treated. Diagnosis is done through a stool test that detects the bacteria or its toxins. Treatment typically includes stopping the triggering antibiotic if possible. Targeted antibiotics such as vancomycin or fidaxomicin, fecal microbiota transplant or FMT for severe or recurrent cases to restore healthy gut bacteria. The page underscores that reoccurrence is common, so follow-up is essential. Prevention and environmental control. The article emphasizes practical high-impact prevention steps. Hand washing with soap and water. Sanitizers don't kill C. diff spores. Bleach-based cleaning of bathrooms and high-touched surfaces. Antibiotic stewardship. Using antibiotics only when necessary. Isolation precautions in homes or care facilities. Separate bathroom gloves, gowns. These measures are especially important in elder care environments. The page outlines several serious risks, particularly for older adults: severe dehydration, kidney failure, toxic megacolon, dangerous colon swelling, sepsis. These complications highlight why rapid diagnosis and consistent treatment matter. C. diff in elderly adults causes. Symptoms and recovery. Symptoms and recovery based primarily on the page you're viewing. What the page is doing. The article gives families and caregivers a straightforward Overview: how C. diff infections start, why older adults especially vulnerable, what symptoms to watch for, and what recovery requires. It's written as a practical guide. Here's how it happens, here's what it looks like, and here's what to do. What C. diff is and how it develops. The page explains that cholesterol tadenoids difficile is a bacterium that infects the colon, often after antibiotic use. Antibiotics wipe out good gut bacteria that normally keep C. diff under control. When that balance is disrupted, C. diff can multiply and release toxins that cause diarrhea, fever, nausea, inflammation, and potential colon damage. Although infections often originate in hospitals or healthcare settings, improved prevention has reduced overall rates. Still, the article stresses that older adults remain at high risk to causes and exposure pathways. The page lists several ways C. diff germs spread, emphasizing how persistent the spores are in the environment. Exposure can come from human or animal feces, food including meat, contaminated surfaces or objects, soil and water, unwashed hands. Because spores survive on long periods or for long periods, even brief contact can be enough to cause infection, especially when someone has recently taken antibiotics. Why older adults are at higher risk. The article highlights overlapping risk factors that are common in seniors age 65 plus. Being assigned female at birth. Healthcare facility stays. Weakened immune system. Chronic illness. IBD, kidney disease, GI procedures or abdominal surgeries, previous C. diff infection. These factors compound, making older adults more susceptible and more likely to experience complications. 4. Symptoms to watch for. The page stresses that C. diff can become life-threatening If untreated, symptoms include watery diarrhea or frequent bowel movements, abdominal cramping, dehydration, blood plus pus in stool, loss of appetite, weight loss, nausea, fever, rapid heart rates. It also lists severe complications: kidney failure, toxic megacolon, bowel perforation, these are medical emergencies and require immediate care. Treatment centers on specific antibiotics that target C. diff. Metronidazole, vancomycin, fidaxomicin. Most people recover within about 2 weeks, but reoccurrence is common. Often within 3 weeks of stopping treatment, sometimes months later. The page underscores the importance of early treatment and close follow-up. Recovery and prevention. The article offers practical caregiver-friendly steps to support recovery and prevent reinfection. Avoid unnecessary antibiotics or ask for shorter courses. Wash hands with soap and warm water. Sanitizer doesn't kill C. diff spore. Disinfect surfaces with chlorine, bleach. Drink plenty of fluids, especially electrolytes. Eat starchy foods, bread, potatoes, rice, oatmeal, crackers to settle stomach. Consider fecal transplant in severe or recurrent cases. These steps help restore gut balance, prevent dehydration, and reduce environmental contamination. Okay, guys, that's your C for this afternoon. I will try and do a D in a bit. Give me a little bit for a break, please, and I'll see if I can do a show D for you. For now, Gator Wellness. Take care, folks. Be back on shortly with D